Habits and foods to avoid for stroke patients. A balanced diet can help stroke patients minimize the 3 risk factors that cause it, such as high cholesterol, excess body weight, and high blood pressure. Essentially, eating limits for stroke patients are determined by each individual's situation. However, it is best to avoid the following foods. What foods should be avoided by stroke patients? 1. Instant food. Instant food is a food product that has been packaged in such a way that it is very simple to serve. Its distinguishing feature is the manner in which it is presented. In most cases, enough to be given or cooked in boiling water for 3–5 minutes. Instant noodles, instant oatmeal, and other similar foods fall within this category. Why is instant food a dietary avoid for stroke patients? The majority of instant food contain sodium nitrate and nitrites. Both of these substances serve as coloring agents and preservatives. Sodium nitrate and nitrite can be harmful to stroke survivors. These substances have the potential to harm blood vessels and cause arteries to stiffen or narrow. These diseases can raise the risk of stroke recurrence and induce heart disease. 2. Foods with a high sugar content. Sweet and high sugar foods are among those that should be avoided by stroke patients. Excess sugar can damage blood vessels, promote inflammation, and lead to obesity. Recurrent stroke risk factors include obesity and compromised blood arteries. As a result, stroke patients are recommended to limit their daily sugar consumption. The recommended daily sugar intake is for tablespoons. Cakes, candy, and bottled drinks are examples of high sugar foods to avoid. 3. Foods with a high salt content. Salty foods include sodium, which can cause an increase in blood pressure. If your blood pressure is not under control, you are at risk of having another stroke. To do so, restrict the amount of salt and sodium in each dish. Avoid exceeding 1,500 milligrams of sodium per day, which is comparable to 1 teaspoon of salt. Avoid processed foods, salty snacks, and fast food, all of which are rich in sodium. 4. Foods that contain saturated fat and trans fat. Saturated fat can raise LDL cholesterol levels in the body. Excess LDL in the body can lead to fat deposition in the arteries. This can reduce blood flow to the heart and brain, raising the risk of cardiovascular disease and stroke. Aside from saturated fat, another form of fat to avoid is trans fat. Trans fat are fats created by adding hydrogen to vegetable oil in order to make it more dense. Trans fat has been linked to an increased risk of several illnesses, including stroke. Red meat, chicken skin, and dairy products are examples of saturated fat-containing foods to avoid. Wiley biscuits, fast foods, fried chicken, French fries and burgers, frozen foods, snack foods such as potato chips, packaged cassava chips and similar snacks, fried foods, margarine, and donuts are examples of trans fat-containing foods to avoid. 5. Alcoholic beverages. Excessive alcohol consumption increases the risk of suffering a hemorrhagic stroke, explained in previous video. Alcohol can impair liver function. This is because the liver produces the protein required to avoid unexpected bleeding. Because of the combination of high blood pressure and disturbance of the blood clotting system, alcohol can raise blood pressure, which is a risk factor for stroke. 6. Smoking. Smoking is strongly linked to an increased risk of stroke. This practice is thought to raise the risk of stroke by up to double by raising blood pressure and decreasing oxygen levels in the blood. Furthermore, smoking causes blood to thicken, increasing the risk of blood clots, which can lead to strokes. According to the Stroke Association, the more you smoke, the more likely you are to have a stroke. If you smoke 20 cigarettes a day, you are 6 times more likely than a non-smoker to have a stroke. If you have previously had a stroke, including a mini-stroke, you are more likely to have another form of stroke if you continue to smoke. In fact, smoking after a stroke increases a person twice as likely to die from the stroke or a heart attack. The same danger exists if you suffer a quiet stroke, which occurs when you have a stroke but are unaware of it. As a result, quitting smoking is one method of breaking the association between stroke and this habit. 7. Consume an excessive amount of coffee. According to a recent study published in the Journal of the American Heart Association, drinking 2 or more cups of coffee per day can double the risk of dying from strokes, heart attacks, and other cardiovascular diseases among those with high blood pressure. According to the American Heart Association, drinking too much coffee can cause high blood pressure, heart palpitations, and anxiety. Caffeine is present in both coffee and tea, but to various degrees. Caffeine levels in an 8-ounce cup of green or black tea range from 30 to 50 milligrams. The Food and Drug Administration, on the other hand, states that the same amount of coffee has 80 to 100 milligrams of caffeine. 8. Use drugs. Stroke is a chronic condition impacted by lifestyle variables such as drug use, which raises the risk factors for stroke. According to Very Well Health, narcotic drug use can result in a stroke. However, not all medicines have the same effect on overall stroke risk since different drugs affect the body in different ways. Some medicines can directly induce strokes due to the way they function, which can damage the blood arteries in the brain. Other types of medicines, on the other hand, can cause strokes by causing damage to other organs such as the heart, kidneys, or liver. Cocaine, amphetamines, meth, and heroin are examples of substances that raise the risk of stroke. Methamphetamine has a very strong effect on rapidly increasing blood pressure. In fact, hypertension is the leading cause of stroke. This is why methamphetamine can raise the risk of having a stroke. Crystal methamphetamine, like cocaine, raises the risk of stroke over time because it causes the blood arteries in the brain to constrict and interferes with other parts of the body. Methamphetamine users may develop abrupt strokes during or after use, even in the short term. 9. Excessive exercise. Excessive activity, even exercise, can have negative repercussions. You are recommended to exercise on a regular basis in order to keep your body healthy and strong. However, excessive activity might have a harmful impact on the body. Many people over-exercise in order to meet their ambitions or goals as quickly as possible. In fact, that is the incorrect way. Excessive physical activity depletes the body and puts it at danger of developing a variety of health problems. Excessive activity might raise your risk of injury or cause high blood pressure hypertension, because high blood pressure is one of the leading causes of stroke. As a result, you should engage in sports within regular limitations, such as 15 minutes, 30 minutes, or an hour every day, or 3 times a week. Paying attention to food intake for stroke patients can help prevent complications and the likelihood of recurrent stroke. Aside from paying attention to diet, you must also follow a set of lifestyle and healthy habits to remain healthy and fit after a stroke.